help lift the leg up when you're lying down, but they're also the ones that keep the pelvis level when we walk 1 foot at a time. When they're weak, the pelvis will droop on the one side, and so that causes a limp. And everybody gets weakness of those muscles. A lot of people get weakness of those muscles before surgery when their hips are hurting and they can't do what they need to. The muscles around the hip can get a little weak. Everybody gets some increased muscle weakness when we do surgery on them. That's part of the recovery, and the main reason really for the walker crutches that first 6 or 8 weeks to protect those muscles while they're healing and getting strong again. And then we'll get variable amounts of return and improvement in function in those muscles. And I think that even at this point, 2 years after one surgery, 1 year after the other, the potential exists for improvement in muscle strength and endurance especially, because it's really the endurance that's the slowest thing to come back. So, you know, being on your feet all day, being up for long periods, things tire out. Even if people walk pretty well at first, the further they go, they have more trouble. That's endurance. So I would encourage you to continue your work with your exercising. There's nothing wrong with the hips, nothing harmful here. You're not going to do any damage if you should, you know, work hard or overdo it. All you'll do is make things sore or ache. So you have to gradually increase what you do so you don't make yourself miserable. But you're doing the right things. I think maybe do them a little more often. You know, for some people, they find that they're the best that they can be if they exercise every day and just make it part of their routine, just like all of us brush our teeth and comb our hair every day. You know, I think for you, if you could work on these hips every day, that they would be better for sure. I've seen people before with single hip replacement. I see them at a year, they're limping because the muscles are weak, and they come back at 2 years, their limp's gone. So for them, it took into that second year for them to get the best that they could be. So I would encourage you to do that. The exercise bike's a great way to do that. If you have one, set it up, get a routine going, you know, watch the morning news or whatever you like doing, and you know, half hour's plenty, and start out with a easy setting, gradually increase the resistance so it's harder and harder to do it. The guy in my practice with the world land record for exercise bike miles, I think, at least that I've run into, a fellow that has his bike in the basement, but he has a reading stand on there. And he likes these Louis L'Amour novels, you know. So he sets them up down there, and he won't let himself read the book except when he's on the bike. So every day he goes down and rides for half an hour or so, and some days he'll go 45 minutes because the bad guy's in trouble and he wants to see if he gets caught or something. And then he stops, and you know, he has to go down there the next day to see what happened in the story. And so that works for him. You just figure something out that helps you keep at it, because it's real boring to just do it without some kind of distraction.
Yeah, I've been trying to figure out how I can read and do it, but I think that
Let's see, you're going to get that
music stand.
a music stand to hold a book.
Yeah, they have these contraptions now. The exercise clubs are a good place to try out some of this stuff where you're going with the trainer, because they have all different versions, and you're going to find that some are more or less comfortable for you. You may find that a recumbent bike is easier because of your back. You've got some arthritis in your back, and you've got a little back pain. A lot of people find if they're sitting with their feet in front of them, that it's more comfortable than sitting on a little bike seat like one of these Tour de France things. Those aren't as comfortable, you know.
Yeah, I like that too at the club. I was going regularly. I think it was, I don't know if I've done it with the left hip at all, but I was going to Athletico, one of those, and 2 or 3 times a week. And I liked those things, and that, I think maybe I should go back to that.
Now the other stuff is all kind of extra credit. That's a bonus. You know, the machine sitting like this works on those same muscles in a different position. Doing those leg lift exercises like we did here, some people like doing those, and they'll hold it for a count of 10, try to work up to doing 30 of those a day. You can put a sandbag on the ankle and help on that. But those are a great thing to do too, so if you get tired of just doing one thing like the bike, you can work on those things, because those isolate those muscle groups. But you know, add those on as extra credit, get one thing like the bike and just try to do it every day for a while, and I think you'll find that this improves.
Okay.
Now, we all have different sort of levels of how good we can be, how fast we can run, how high we can jump, you know. And we never really know what the upper limit is for any individual hip or person, but I'm quite sure that your hips can be better. Whether we get good enough that you choose to go without the cane, that'd be great, but I don't know. Sometimes there are other reasons to use a cane. People sometimes feel more steady on their feet, like they're, you know, not going to tip over if balance is an issue or other joints hurt or the back bothers. So you can decide. There's no penalty to using the cane, and there's no huge advantage going without it. I think it's just a matter of what you prefer and how you feel steady and safe. And some people will find that when they go out of the house, they take the cane along just because they don't know what the sidewalks are going to be like, and around the house they go without it. That's fine too.
Is there anything you shouldn't do to endanger the hip?
The only precaution really is against dislocation. We don't want people bringing the knee up and in across the front of the body and turning it in like that, because you can pop it out of joint. So from a practical standpoint, and that's a permanent restriction, we've had people dislocate for the first time 10 years after their surgery, no trouble before that, so that risk never goes away. But it's not a real big deal. I think shaven legs, buckling ski boot buckles, there's only a couple things that I can think of that you know, my patients want to do that get them in that position. So if you put your knees apart, if you work between your knees, you're safe. So if you're like a frog, throw shoes and socks, toenails, whatever the activity, you're fine. No problem.
Okay.
So you can help Mom with the ski boots.
Yeah, well,
There you go.
forget our ski boots.
There you go.
So what about walking around the neighborhood? I mean, it's
That's
pretty
fine.
good sidewalks, and
That's fine.
you know, we're always nervous about falling, but I think it's a pretty good.
No, I think that's fine. Walking's great, especially when the weather's nice. Regular bike outside is fine. But we like the exercise bike thing because I haven't had any of my patients fall off yet or get hit by a car. So.
Right, that's right.
Now, do you have a good enough bicycle? I mean,
Yeah.
Yeah, it's pretty good. It's been using it.
Yeah. You can come over and try it out.
Yeah,
Okay,
that's the deal.
all right.
We'll see you again in a year, or sooner if you say so, but in a year, we'd like to see an x-ray or see you with regard to this most recent left hip. That'd be our usual routine at 2 years. If things look good then, we back off and see people less often, every 2 to 3 years, with an x-ray just to be sure the implants look okay. And those can be sent in too, if people are doing well. If you're having any trouble though, it's best for us to see you, because it's easier to sort out.
That's what I figured, because I did think, I was tempted by the x-ray idea and the.
Yeah, but I'm glad we had a
thought-
chance to see you. It's
I
a
thought
good
I
chance to
better-
see what's going on.
Okay.
All right, any
All right,
questions
and
about any of that?
If I decide that for me, it's best, I need to get back to Athletico, can I call in for a prescription?
Yeah,
Or should I get one locally?
yeah, you don't really need a prescription to do the things we've asked you to do.
Yeah,
Or the other way to say it is, somebody asks us, you know, if there's some medically necessary, you know, special
Yeah.
form of therapy, no. I mean,
yeah,
all of these are things that you can do on your own. And the other way, I'll sometimes say to people, you know, at this stage, I'd rather have you take the time you'd put into getting cleaned up, putting on a nice outfit, driving across town to the therapist's office on the bike. You'd be done by the time you get there, if you just do it,
okay,
you know.
okay, I understand.
Okay?
Now, can I ask you one?
Sure.
I had this sepsis, source unknown so far, but, so I was on 7 weeks of gentamicin because of the vegetation on the aortic valve. So I've cured that, but I've become dizzy, imbalanced. Do you have a person that knows that's good on imbalance
So, we do.
that you would recommend, or I could talk to him? And I have another friend who's another pilot that is going crazy. He's got, he's 89 years old, a terrific guy. He won the Kentucky Derby, or his horse did 3 years ago.
Wow.
He wants to go out the stable and just touch the horse again, but he can't do it because he's in balance. It's frustrating, because I feel great. physically, but I just, they want me to follow.
Yeah, so,
He can't drive or anything.
right,
Nobody told me not to, I guess I could.
But, he just thought maybe somebody up here would have a.
our
better-
ENT group is the group to start with. And,
ENT.
okay, yeah, and they can look into this and determine the source of the problem. For people that have hearing aids, sometimes there can be balance issues related to changes that occur in the inner ear as time goes by. If you hadn't had this history of the infection problem and treatment, then we'd be wondering about that source. The gentamicin, as you may know, we worry about as a drug that can harm vestibular function. And it can be one of the side effects of treatment with that medicine, and it's a dose-related issue. And so it can cause ototoxicity or damage to the nerve, you know, that controls balance. So and then there's probably about 15 other things that a simple bone doctor wouldn't think of that will affect balance. So that's why we have a group of people that work in that area. So,
ENT, what is he?
yeah,
ENT.
yeah, ear, nose, and throat. So that's the area. It's in your ear. You know, that balance is generally the source of the trouble. So we can try to set up such an appointment for you. I don't know when I can get it for you, if we can get it this trip or not, but.
No, it'll be another trip
For a
in
few-
2 or 3 weeks or something.
Okay, sure.
So how should he proceed?
We'll go after the desk.
Okay.
We'll have Fred and Dan work their magic out there and see if they can set up an appointment for you.
This Fred?
Yeah.
Okay, good, great.
He's worked for 25 years, so.
No, he told me to see what it
It's
was.
getting tougher for him though, around here. I'll tell you what, we have more goalies than we do skaters on the team. Yeah.
Nice to
Okay.
talk to you, doctor.
Yes,
Good to see you.
thank you.
I'll see you again in a year.
Okay.
I'll see you before that if you say so.
All
Okay?
right.
There's fun.
Okay.
Nice to see you.
Thanks very much.
You bet.